The Psycholinguistic Assessment of Language Processing in Aphasia, otherwise known as the PALPA. What is it? The PALPA is an assessment tool used to assess the language processing skills of individuals with aphasia. It is comprised of 60 subtests divided into 4 main categories, including auditory processing, reading and spelling, picture and word semantics, and sentence comprehension. It can be used as a clinical tool or as a research tool. When is it appropriate to use? The PALPA is an appropriate assessment tool to use when identifying the language processing skills of an individual with aphasia. When is it not appropriate to use? The assessment should not be used for testing language use as a means of communication. It also should not be used for determining how to treat a client. This test only provides information about the aspects of language processing that are difficult for the client. In addition, the test in its entirety should not be given to an individual. Only relevant subtests tailored to the clinician's hypothesis about the nature of the language impairment should be administered.
What information does the test give you? This assessment gives us information about the patient's language abilities by assessing language processing skills through the examination of recognition, comprehension, and production. Overall, the subtests give us information in regards to auditory processing, reading and spelling, picture and word semantics, and sentence comprehension. Why is this test useful? The PALPA is useful because it allows us to identify the modalities of language processing that are impaired and preserved in a person with aphasia. It also helps provide a basis for creating treatment plans. What are the main components? The PALPA consists of 60 subtests divided into 4 main sections: auditory processing, reading and spelling, picture and word semantics, and sentence comprehension.
How is it administered? To begin the administration process, the clinician must choose the most appropriate of the 60 tasks to administer. Selection should be based on difficulties the client is experiencing related to language processing. The tasks chosen must be administered in any order. Each subtest requires different instruction, which are given to the client before the start of each individual task. After each subtest, there are suggestions about which task to administer next, based on the client's performance. At this time, the clinician will record the client's answers on the protocol sheet. At the end of the test, the clinician will then score each subtest and generate an overall score. How long does the test take? The length of assessment administration depends on several factors, including the severity of the client, the specific subtest administered, and the number of subtests administered. To reiterate, the assessment is not designed to be given to an individual in its entirety. What materials are needed? In the clinic, you will find 2 large binders that contain stimulus materials and 60 subtests of components of language structure, such as orthography and phonology, word and picture semantics, morphology, and syntax. You will also need protocol sheets and an examiner's manual.